We got our start in 1969 when the Fort Wayne Medical Society, along with a group of volunteer doctors, started a well baby clinic named Three Rivers Neighborhood Health Services. Our goal, even 50 years ago, was to provide the children of low-income families with proper health care. In the beginning, the clinic offered physical exams and immunizations for children from infancy to 6 years old. Fees were based on ability to pay, ensuring that all children in the community had access to quality care. In our first year, we examined approximately 18,000 children, and before the end of 1969, it was announced that Three Rivers Neighborhood Health Services would expand to offer prenatal care and family planning.
I love the staff here. They have been nothing but kind and always follow up.
By the mid-70s, family planning and prenatal programs were fully established in collaboration with Parkview, St. Joseph, and Lutheran hospitals. Along with the Fort Wayne Medical Education Program local residency program, where residents provided medical care to our prenatal patients, and still do today. In those early years, Edward Clockey, our family planning administrator, prioritized community awareness of such vital services, often speaking to schools, hospitals, and other members of the community. Approximately 30 volunteer physicians, many of them gynecologists, as well as several nurses, rotated through the clinic, providing necessary examinations and screening tests for women.
Smile from the receptionist, and as soon as I reach the second floor, I am greeted by all the wonderful staff by name.
By this time in the 1980s, we'd grown from 1 full-time staff member to 12. Along with increasing community involvement and the team of volunteers, we outgrew our first location and moved in 1987 to the newly renovated building, One Canal Place, located on the corner of Main and Clay Streets in downtown Fort Wayne. This new space gave us more room to accommodate a larger number of patients and allow for the expansion of even more programs. Throughout the next few years, we grew to offer clinical treatment programs for sick mothers and children. Perhaps most notably in this time, we became the local headquarters for the Women, Infants, and Children program, commonly known as WIC. This allowed our clinic to serve Allen and the surrounding counties, providing families with proper nutritional and developmental health care.
Awesome service for those in need.
In 1994, Three Rivers Neighborhood Health Services was reincorporated as Neighborhood Health Clinics. By the next year, the need for further expansion was evident. We relocated to the former Lutheran Hospital building located on Fairfield Avenue. This progress allowed for our first full-time physician and nurse practitioner to be hired. Because of these new providers and because of continual support from our community, we were now able to provide primary care medical services for all ages and genders. By the 90s, our team of staff and volunteers had grown significantly. We were now operating with 50 full-time staff members and a dedicated team of volunteers from the community. This growth allowed us to serve an average of 14,000 patients each year. We also welcomed a new CEO, Mary Hoppert. Under her guidance, NHC grew to offer a broader range of health services.
Down to earth, knowledgeable, and thorough. All the staff here is always helpful and answers all my questions.
Through the dedication from volunteers and staff, as well as with community support, Neighborhood Health Clinics became a federally qualified health center. This status granted us funding to continue to provide the underserved with quality healthcare services. The added funding also meant we could begin to offer even more programs to serve Fort Wayne. By the end of the 90s, we opened a dental clinic that provided the community with basic dental care needs. In our first year of offering dental services, nearly 7,000 people were served.
The dental staff is empathetic and helpful. I'm grateful for the Neighborhood Health Clinic's dental services.
In addition to dental care, NHC was able to begin offering breast and cervical cancer screenings at no cost to the patient. This afforded us the opportunity to provide potentially life-saving programs to women in the area who could not have afforded it before. The early 2000s were a nervous and exciting time for neighborhood health clinics. When news broke that the former Lutheran Hospital building on Fairfield was to be torn down, it opened up a new era of opportunity for us. With the help of many community members, the clinic found its current home on South Calhoun Street and moved into the newly renovated building in 2000. 2 years later, WIC would begin services in the neighboring building. In the years following our move to Calhoun, we would grow to offer a dental sealant program for Title I schools, a dental referral service, and a medication assistance program. In 2012, construction began to unify the WIC building and NHC for patients to easily access services. A parking garage was also resurrected that included a sky bridge. In our efforts to best serve the community, a satellite location on Paulding Road was established in 2014 with the assistance of Parkview Health. In 2016, Angie Zagel assumed the role of CEO. Under Angie's tenure, we expanded to include on-site vision services and behavioral health.
Affordable, professional, and in the nearly 30 years I've worn glasses, I've never had a prescription this good.
50 years ago, we saw a need for quality healthcare services and aimed to make them accessible to all in our community. As our staff has grown from 1 to 160, our mission has never wavered. Since the beginning, we've been focused on meeting the healthcare needs of those most vulnerable in our community. As we look to the next 50 years, we see ourselves continually transforming to provide the services our patients and our community need to live a healthier life. We want to be representational of our community as it exists now and with what the future has to hold. Neighborhood health has evolved significantly in the last half-century, and we want to project our image and dedication in a way that is modern, professional, and inclusive. In the years to come, we will continue setting ourselves apart, providing excellent care, and meeting the needs of our community. We present the future of neighborhood health.